right, why don't we go ahead and get started? And as folks join us later, they can. Welcome to those of you who are here right now. My name is Molly Wheeler. I'm one of the deputy directors with the Utah League of Cities and Towns. We're really excited about today's webinar with the Utah Fentanyl Task Force, and we have some great speakers for you to hear from today. Just so you know, we do have a lot of speakers, and we want to make sure we hear from everyone. And so we're not going to take questions until the very end. They also have an email address that they'll be sharing and there's slides they'll be sharing. So if for some reason we don't get to your question, know that there will be a point of contact that you can follow up with. Also, welcome to follow up with anyone at the league, and we're happy to help connect you. So with that, I'm going to turn the time over to Bill Newell, who will kind of MC us and introduce us to all of his great colleagues. Bill, time's yours.
Great. Thank you, Molly. Hey, I really appreciate it. I appreciate the opportunity to speak to everybody on this call, represented through the Utah Leagues of Cities and Towns. Again, as Molly said, we have a great lineup of speakers, so I'm going to try to go as quickly as possible. There's a little just for some background. So a few months ago, the governor's office reached out to several departments, several entities within the state, and asked to come up with a strategy focused on, combating fentanyl from different aspects. And so the slide you see on your screen is really the mission statement that we came up with back in October. And then we had our first meeting at the state capitol in mid-November. And if you notice, we're really focused on um, four different aspects, and each of the working groups will speak about that today. But one of the things that, as a law enforcement veteran, and the governor and the commissioner from the Department of Public Safety wanted to make sure that the phrase task force connotes obviously very heavy public safety. We actually made that, if you notice in our first sentence of our mission statement, law enforcement efforts are actually last, because we think there's a lot of other work just as important, but that's really critical in ensuring that we're looking at this through four different aspects that we'll cover here in a second. So again, we had our first big meeting in mid-November at the state capitol, where we met with numerous individuals, about 60 leadership, state leadership, county leadership, local leadership from around the state, with a focus on fentanyl as an issue you're aware of. I say we collectively as a group, we know this is something that's been really impacting the state significantly, and all, not just law enforcement, public health, public safety, the community-based organizations. We see this across the state. So we're really concerned about this. We came together as a team, and we're looking at all aspects of this. One of the reasons it's still relevant, even though this is recent CDC data that's national, it takes a while for that information to get validated. It rolls up from the states, the counties, and so this is as most recent as possible. Megan Brockmeyer from the Medical Examiner's Office will be one of the last speakers, along with Casey Robinson, and from the Department of Health and Human Services. But one of the things that concerns is, you might have heard this in the news, nationally, drug overdose deaths, of which about 70% is fentanyl involved, have actually been on a downward trend now, which is a great thing. We would love to be part of that downward trend. Unfortunately, Utah, we're not. In our region, we're still slightly on the uptick, and we're hoping to address that through the multiple groups that we're talking about, that we're going to be talking today. So again, I know many of you may be familiar with fentanyl. Many, some of you have a basic knowledge, or some more advanced. So what is fentanyl? And we're talking about here illicit fentanyl, right? This fentanyl is obviously used in the medical industry for a lot of different things, legitimate reasons to do that. But the fentanyl we're talking about is illicit. And one of the main things I want to talk about, at least in this slide, is the fact that Mother Nature plays no part when it comes to the drug cartels and why they're interested in synthetic drugs, things like methamphetamine, things like fentanyl. Mother Nature plays no part as it does in things like heroin, cocaine, which is organic based, heroin's organic based, marijuana, of course. So fentanyl, just like methamphetamine, is a synthetic drug, so it can be manufactured really, 7 days a week, 365 days a year. You just need the precursor chemicals. Most of the fentanyl, I'd say significant amount of the fentanyl, illicit fentanyl that we're seeing here in Utah, is coming from across the southern border with Mexico, is being produced in Mexico by Mexican drug cartels with precursor chemicals, predominantly from China. Now, why is this an issue nationally? I say we, again, our community of the people that are on this call that represent a lot of great organizations throughout the state. Nationally, we are what's known as the fourth wave of the opioid epidemic. The first wave really was the overprescription of opioid medications, due to a lot of awareness, a lot of training, the medical industry, and a lot of different things. That there was an awareness that the overprescription of opioids was a problem. So that started to trend downward, and that was wave one. Wave two was the rise in heroin as individuals who unfortunately became addicted to those prescription opioids or succumb to substance abuse disorders related to that. Then they would turn as prescribers stopped prescribing that, they would turn to unfortunately to things like heroin. So we nationally saw a rise in heroin, and then unfortunately as law enforcement and public health and public safety and many others started focusing on that, then there was a rise in fentanyl. Or an emergence of fentanyl really nationally about 2013 in the state of Utah, about 2015, 2016. We in the state of Utah usually lag 2 or 3 years behind in what's sort of the national trends. And I can get in, if anybody wants more information, those specifics, we can certainly get into that at a different time. Then what the fourth wave now is we're seeing fentanyl mixed in with stimulants, which is a concern, things like meth. Um, That's a concern because Megan Brockmeyer from the ME's office will talking a little bit about fentanyl involved because fentanyl is really in a lot of different things, which is of concern to us. This is my last slide. I think it is my last, or two more slides, and then I'm going to turn it over to Helene McKenzie. But so this is one of the slides we used in the presentation in mid-November at the state capitol. It shows really the law enforcement seizures of fentanyl. If you notice, about 2018, 2019, they started trending upwards. Not only fentanyl powder, which is of concern. So we work very closely with the DPS crime lab. They're the ones that receive all the seizures from around the state from law enforcement. Those substances get tested. And as we started seeing seizures rise, obviously the crime lab started seeing their testing of fentanyl positive rise as well. And if you look at a map or you look at a chart of fentanyl involved overdoses for this, it would mirror this. Why wouldn't? I mean, as public safety started seeing fentanyl arrive, illicit fentanyl again arriving in Utah. Obviously, the medical examiner unfortunately started seeing a rise in fentanyl involved overdoses. So again, this is showing, I know it's a little confusing slide, but this is the crime lab's data showing as fentanyl, really rose with submissions. Okay, so here we go, the meat of the call. So in our preparation for the Fentanyl Task Force, we came up with proposed, and it was agreed at the mid-November meeting, we would come up with four working groups. And Helene, I think I said I'd turn it over to you. I actually turn it over to Ethan, all right? Yeah, okay, good. See, Helene, you've got to keep me on track. So we created four working groups, a lot of discussion about why these working groups were created and what the substance of each. Data analysis, obviously looking at good data from public health, public safety, prevention, treatment, and recovery, of course, is a critical component, as is outreach and education and enforcement, prosecution, and sentencing. I will cover outreach and education, enforcement, prosecution, and sentencing. But with that, I'm going to turn it over to one of the working groups. Oh, and each of these working groups has a coordinator that are on this call, and some additional individuals like Megan Brockmeyer and Casey Robinson, who have critical information at the end of this call in terms of the impact of what we're seeing on the medical examiner and overdose fatality reviews committee. So with that, I will turn it over to Ethan Temez from the SIAC, which is the State Information Analysis Center within DPS.
Excellent. Thank you, Bill. Hello, everyone. My name is Ethan Temez. As Bill said, I work over at the SIAC. I'm the supervisor over our organized crime section, and our organized crime section encompasses the drug aspect of what goes on in Utah. So I'm here with my co-coordinator, Steve Gilley. Steve, if you want to introduce yourself.
Hi, good morning. Yeah, my name is Steve Gilley. I'm the Overdose Response Strategy Drug Intelligence Officer for the state of Utah.
Thanks, Steve. So as you read through this paragraph, I think one of the things that sticks out right off the bat is that we're here, or this working group has been created for that, collecting that real-time data. So those graphs that Bill walked us through at the beginning, a few of those were created by our SIAC drug analyst, who is working with all of the state task forces to try to track down how much fentanyl we're seizing, or I even should say encountering. And then because it's a working group, we want to include our DHS partners and our other community-based organizations, because they're also encountering fentanyl. And so with the creation of this task force, it allows us to go out and try to collaborate together. And creating this group, we can try to bring all the great minds together and really take a step into action in solving this crisis. So you can see all of the members within this group. We have Rocky Mountain Hideout, which is our the Rocky Mountain Region's High Intensity Drug Trafficking Association. So basically, it is federally funded, and they are comprised of 7 different task forces throughout the state of Utah. And so those representatives we speak with regularly. We have the SIAC, which is where I'm from, the DEA, and the DHS Office of Intelligence and Analysis, and then the DPS Bureau of Forensic Services. So again, working with the lab and what are they seeing being submitted? What is fentanyl being mixed with? Or are we seeing any chemicals that are changing within fentanyl out on the streets, right? So that's where the analysis comes into play. So moving on to the next slide. One of the things that we want to do is create a dashboard, right? So what are we doing as the data and analysis group, and how are we going to present this information not only to the partners and the other people within the group, but we want the public to be aware of what's going on as well. So many of those organizations that I spoke about before, they have their own dashboard, and it's not something that we have for DPS specifically focused on fentanyl. You'll find, or I should even expand that to other drugs as we create this dashboard. So while fentanyl is going to be that first step up, we want to get ahead of what may be coming in the future for any of those analogs that fentanyl is turning into. So the dashboard will be Power BI based, so it'll be interactive for anyone that does access it on the DPS website. Should caveat that it's not out currently. This is something that's new, and we're still gathering the information to create it. It's also going to be something that we will collaborate with DHHS. So Megan and I have spoken before about how can we overlap this fentanyl data and our drug overdose data. Yes, we can do side-by-side comparisons, but collaborating together under this this Fentanyl Task Force initiative, being able to really overlap that information. So again, moving on to the next slide, we have the objectives. So this being a new initiative and the group really only being founded a few months ago, these were the key things that we want to make sure that we get with this dashboard, right? So working closely with our stakeholders. Again, we're in that gathering, validating, and integrating data stage, and having our own internal dashboard for analysis, and we'll also make that public dashboard even better, right? Really getting the public the information that they deserve to have. And then we want to ensure that all this data is accurate, reliable, and up to date. One of the things that Bill said earlier rings true in a lot of these charts that we see is that it takes time to validate the data, right? So when we seize fentanyl off of the streets, it needs to be sent in for testing, and then it needs to be verified that it is what we assumed it to be. And so it may take a week or two, but to give those accurate reports or create those accurate tables and charts, it may take time. So this group's goal is to shorten that time. And instead of getting every year or biannually getting reports, we want to shoot for quarterly. And then as we progress, get even better at updating that information. And then again, ensure that all stakeholders and external partners, and that includes the public, knows how to use this dashboard that we're creating, allowing them to walk through the information to know what's happening with fentanyl out on their streets, what's really going on. And so again, that data and analysis group, that's really our key goals in this upcoming year, is get this dashboard out to the public, create one internally for local law enforcement, get accurate and true numbers of the situation we're currently in with fentanyl. And that wraps it up for my side.
All right, great. Thank you, Ethan. I will turn it over now to Helene McKenzie.
Hey, can everybody hear me? Great. My name is Helene McKenzie. I'm a licensed clinical social worker for the Department of Public Safety. I'm joined by Reshma Arrington. Do you want to introduce yourself, Reshma?
Yeah, I'm Reshma Arrington. I'm the public health analyst on the overdose response strategy Um, Actually, Steve Gilly is my DIO, and we partner a lot together. But I've been with this ORS team for about over 2 years now.
So Reshma and I are working on the prevention, treatment, and recovery group. And as you can imagine, that covers a lot of topics and people and ideas and work. So the list you see here of members is certainly not exhaustive, but these are ideas or folks that we'd like to collaborate with, or maybe we have already, and people that we're really hoping to get good feedback from in the community. So on our next slide, this, when Reshma and I first came together, we were, really working on framing what are we asking? What are our questions? What do we want to know? And so here you can see that we've framed some information, which are the 2023 and 2024 fentanyl-related cases of non-fatal and fatal overdoses. And what I believe this information highlights is genuinely the fantastic work that's being done by so many folks in the community, whether they work in any one of these areas, prevention, treatment, or recovery, that we see this gap in fatal overdoses and non-fatal overdoses is due to that work. So we certainly want to highlight that the Fentanyl Task Force isn't here to tell you what to do with your programs, because we can see that you're making a difference. And what we really want to do is advocate for and support the great work that's being done already. And then also, we'll get to this in a minute, but discover perhaps what some of your barriers and challenges are and ways that we can be supportive. What we wanted to highlight here in these flags on the right, well, they're on my right. I don't know, it's a prison. So some things that are impactful in reducing overdoses: the availability of naloxone, post-treatment recovery, harm reduction, and referrals to treatment. And when you have a moment to read these, I think what you'll notice is that community outreach programs are essential to treatment and recovery. For example, in referrals to treatment, you can see where the Utah Syringe Exchange Network has made, just at their events in 2023, there were over 8,000 direct referrals to treatment. So these outreach groups are critical in getting people the help and services that they need. Next slide, please. So we also wanted to point out some groups that are working in those areas that we would love to hear from. We're organizing a seminar, if you will, in early February, where we'll be inviting key stakeholders to give us some feedback. And I would love for Reshma to talk about what recommendations and the information we're seeking from folks out there.
Yeah, so a little backstory is that Utah has participated in a program called the Drug Monitoring Initiative, and it's been around for over 5 years. And it really kind of encapsulates everything drug related. One of the side projects of this group has been to create a fentanyl specific report that was produced in 2021. And Helene and I are going to update that report to current day. And we're going to take the recommendations from that fentanyl report and ask this panel of experts to evaluate what Utah's progress is on those recommendations. So some of the recommendations you could see: coordinating more public awareness, giving more access to and distributing naloxone. A lot of these are focused on kind of for us, by us, really making sure that people who are experiencing drug use and overdose, that they're helping us to know what what is working for them. All of these programs that are going in by their local health departments or their advocacy programs or the state department of health, what's actually working? Is it really meeting down to that direct level of interaction?
So hopefully we'll have the benefit of having feedback from folks that I'm sure a lot of you know, and maybe even some of you, so that we can have policy that's driven by really community and boots on the ground experience. I believe it's one of the great government blunders to write policy without really direct feedback from people with lived experience and with providers in the community. So we're really excited to collect that feedback and hopefully make some I will see, where it leads, but the idea is policies or advocacy for what we're seeing at this time with fentanyl in our communities.
I appreciate that, Helene, because and Helene and I have had, all the working groups had that discussion. One of the fears that we all had when this task force was first announced was that somehow we were going to be, telling people what to do. And that is not what we all agree. We are advocating. We want to advocate for. We want to be an additional voice for you and your efforts at the highest levels of state government. And so the commissioner from DPS agrees with that. And matter of fact, yesterday, and I told the group this yesterday, I had an opportunity to talk to the governor and brief him on what we're doing. And he made it very clear, and which is music to our ears, to make sure that rural Utah is fully involved, that we're fully collaborating with rural Utah, throughout the state, which is one of the reasons he was really happy to hear about the call today, the webinar today. So thanks again to Molly for setting this up. I'm going to cover outreach and education really quickly because the working group coordinator is not available. But again, very quickly, outreach and education is obviously self-explanatory, but we're working really closely with all the partners here, the School Board of Education, with DHHS, public information folks, with a lot of the great community organizations around the state that are doing phenomenal work in this regard. We're going to be working with the media a lot. We briefed that to the governor yesterday. We want to make sure we're getting the word out, mainly because of this. And you probably heard this a lot. One pill can kill. There's all different kinds of media campaigns out there. And we're all, we all live here. We have families here. We want our families to be safe, to be aware. Awareness of the threat is key. A lot of folks that I go around the state, do public events, talk about this, and there's still individuals who have it's becoming more and more knowledgeable, but that there is this big issue of the threat of fentanyl. So again, that's quick. I'm going to cover this as well. Because of my background in public safety, I've been working very closely with this group. This is law enforcement group is comprised of sheriffs, chiefs, state, federal, and we want to make sure that we're bringing all those representation of all different levels of law enforcement, public safety to bear, along with the courts, along with the Statewide Association of Prosecutors, defense attorneys, sentencing commission, to focus on how can we hold those people accountable that are in fact trafficking fentanyl, not the low-level individuals who are dealing with substance abuse disorder, but the individuals that are involved with the trafficking distribution level of fentanyl throughout the state, coming in from the border, coming in from Southern California, Arizona, coming into our state and actually bringing this illicit fentanyl and other substances to the state, obviously with the focus on illicit fentanyl. So we've had a lot of great meetings with both public health and public safety, really bringing attention to this issue, and the work continues. This is the progress to date. We're just doing a lot of training, a lot of awareness. I've been going around meeting the task force commanders. There's throughout the state, as well as the courts, representatives of the courts, representative of the sentencing commission, representative of prosecutors, both on the defense side, of attorneys, both on the prosecution side as well as the defense side. We have a meeting coming up with the new attorney general, myself and the commissioner. How can we partner with them as well to ensure that that this is a clear message that we're sending out to those individuals who are knowingly and actively, willfully bringing in large amounts of illicit fentanyl as well as other drugs into our state. and holding them accountable, especially when those instances, excuse me, result in a fentanyl involved overdose and death. So, with that, I will turn it over to Megan Brockmeyer from the Medical Examiner's Office.
Thanks, Bill. Hi, everyone. I'm Megan Brockmeyer. I'm a forensic epidemiologist in the Medical Examiner's Office. I'm part of a small epidemiology team that's really trying to better understand the circumstances that lead to a fatal drug overdose. And then, of course, another goal of our work is to measure the impact of fatal overdose on our state. Next slide, please. In Utah, poisoning is the leading cause of injury death. So this does include drug overdoses, of course, which make up the largest proportion of drug overdose, or excuse me, of poisoning. This also includes things like carbon monoxide deaths. But as you can see here, poisoning is increasing over time, and it outnumbers the number of deaths by firearm, fall, and even motor vehicle accidents. Next slide, please. The drug overdose death rate, again, has increased over time. So you really see this pretty significant jump from 2000 to 2015. The rate in Utah peaks in 2015, and then it's stayed pretty stable since then. So really unchanged. And we also see that the count of drug overdose deaths has been increasing over this time. And we include both the count and the rate to really demonstrate the impact of fatal drug overdose. And rates help us standardize the number of people who died compared to the population. So that allows us to compare place or sex, age, race, or something like that. So, for example, it wouldn't be appropriate to just compare the number of deaths in Salt Lake County to the number of deaths in Tri-County Health District. So we use that rate to help standardize and to make sense of the population changes across the state. Next slide, please. So it's encouraging, of course, that we haven't seen a big increase in our rate over time, especially, since nationally we were seeing huge increases, year-over-year increases in overdose deaths. However, there were 606 overdose deaths in Utah in 2023, which is the highest number on record. And this represents an almost 14.5% increase in the number of deaths from 2022 to 2023. So I think I can speak for all of the task force members on the call today and that are involved in our group that we're committed to reducing the number of deaths, not just to sustaining the overdose rate. Next slide, please. This slide has a lot of information. There's a lot of different stories here, and I really want to highlight everything because they all play a really important piece in understanding what's going on with fatal drug overdose. So the types of drugs commonly involved in our overdoses have changed. Fentanyl and methamphetamine were the most common drugs involved in overdoses in recent years, compared with prescription opioids and heroin, in previous years. So methamphetamine was involved in 46% of fatal drug overdoses in 2023 and was actually the most commonly involved single drug that was listed as cause of death from 2017 until fentanyl surpassed methamphetamine in 2023. So you might remember when in the beginning of the presentation, when Bill was talking about us being in the stimulant and fentanyl wave of the overdose crisis. And this really demonstrates that visualization as well. Fentanyl became the most commonly involved drug in overdoses in the US in 2023. So again, as Bill had said, we're just a couple years behind what we're seeing nationally. And then in 2023, fentanyl was involved in 47.9, so almost 48% of our drug overdose deaths. Another interesting story here is that we're seeing a pretty significant decrease in the number of deaths involving opioid prescriptions. So in 2014, 65.7% of our overdoses involved at least one opioid prescription. In 2023, it dropped to 27.9. So that's a significant decrease, of course. And going to go back to what Helene was saying just about all of the great work that's going around the state. I think this particular metric really demonstrates the amount of effort and energy we have put into reducing opioid prescription, which I think is really encouraging. To go back and talk a little bit more about the substances involved in our overdoses, another kind of emerging and interesting trend is that we're seeing an increase in the number of deaths that involve gabapentin. Gabapentin is now the third most common single drug involved in overdoses. So it's actually the most common prescription drug. It surpassed oxycodone, morphine, and even heroin. And so I think just something to all keep our eyes on. And then we've seen another pretty significant decrease in the number of heroin deaths. So heroin deaths really peak in 2016, and then it was staying pretty stable, slightly trending downward until we see a pretty significant drop from 2022 to 2023. And I'd like to just mention xylazine. People always ask me, about different types of emerging threats like xylazine or carfentanil. Both of those drugs are we're not seeing those very frequently in our fatal drug overdoses. Xylazine, for example, was involved in fewer than 1% of all drug overdoses during this period. And it's actually, the counts are too small to include.
Yeah, that's a great
Ahead,
point, Megan. Since I brought up tranq several times, that's xylazine is known, you might have heard in the media, known as tranq because it's a large animal tranquilizer. It is a major concern back east. It's really causing a lot of things like necrosis and muscle tissue where repeat injection areas. We have not seen that, luckily, to the extent that would really not require, but to highlight it other than what Megan said. So we're keeping tabs on that. We're working very closely as a team to ensure that anytime we see something like that, we jump on it. So thanks for bringing that up, Megan.
Oh, you bet. And I think just an interesting point about the xylazine is that, it's not really posed itself yet as a significant public health threat as far as fatal drug overdoses go. But what's interesting is that we've seen fentanyl involved in all of the xylazine deaths in the last 2 years in Utah. So it's definitely here. We know that. But as Bill said, just staying vigilant and understanding what's going on. Okay, so the number of deaths from fentanyl is 12 and a half times higher than it was in 2014. So there were 23 fentanyl deaths in 2014 and 290 fentanyl deaths in 2023. So a significant increase. Again, one of the biggest reasons why there even was the formation of the Fentanyl Task Force. The number of deaths, we've really seen this huge increase, of course, start in 2019. So we start to see higher numbers of fatal overdose deaths in the first quarter of 2020. So the number of fentanyl deaths from 2019 to 2020 more than doubled, and then it's just continued to increase. And it's, we're trying to, better understand what's going on with trends and kind of, forecast what will happen. And I think it's fair to say that if we continue to see these significant increases in the number of fentanyl deaths, we will see a true increase in our overdose death rate. Next slide, please. Again, just to really drive this point home, the majority of fentanyl overdoses involved more than one substance, and the most common substance involved in a fentanyl overdose was also involved methamphetamine. So when I say involved, this means that both of those substances were listed on the death certificate as cause or contributing to death. So an interesting point here, between 2021 and 2023, 85% of our overdoses involved multiple substances. And for that same time period, for other substances, that number was 74%. So it's a little bit higher. We see more polysubstance deaths with fentanyl than other substances. And then other common substances involved in overdoses would be alcohol, gabapentin, and heroin. Next slide, please. Males are much more likely to die from a fentanyl overdose than females. The proportion of males to females was higher in fentanyl-involved overdoses than other substances. And you can see on the slide that nearly 4 of 5 fentanyl overdose deaths are among males. And this is for the whole state of Utah. The average age at death was 7 years younger among people who died from a fentanyl overdose than those who died from another substance. And then the highest rate among other overdoses was among people 35 to 54, compared with 25 to 44. So people who are dying by a fentanyl overdose are on average younger. And the highest rate, the 25 to 44, was found for both males and females. Fortunately, overdoses among children, so people ages 0 to 17, are rare for all overdoses. Still, the alarming thing about this is that the proportion of fentanyl overdoses among this age group is high. So in 2023, between 2021 and 2023, 80% of overdoses among this age group involved fentanyl. And then lastly, I just wanted to show the burden by a health district. The fentanyl overdose death rate was highest in Tri-County between 21 and 23. So Tri-County includes Daggett, Duchesne, and Uinta counties. And then Weber Morgan and Salt Lake Health Districts as well all had significantly higher rates than the state rate. And next slide, please. So I think when talking about mortality data, it's easy to sort of lose sight of what it is that we're counting, but each one of these data points likely represents the tragedy of someone's lifetime. And especially with drug overdose, we know that oftentimes that tragedy started well before their untimely death. And again, our task force is hugely committed to preventing overdose. We know that overdose is preventable. So again, as Helene has mentioned, we have strategies in place that we know are effective. We can demonstrate that by the decrease that we've seen in opioid prescriptions. And these efforts really move the needle a tiny bit in the right direction. We also have our next speaker, Casey Robinson, who is the coordinator of the fatality review team. And so she oversees one of those prevention efforts that's moving our needle just a tiny bit in the right direction. So I will pass the time over to her.
Thank you so much, Meg. Thank you for having me. As Meg mentioned, I am Casey Robinson. I'm the fatality review specialist in the Violence and Injury Prevention Program with the Department of Health and Human Services. And we do have several different fatality reviews. Today, I'm going to be speaking just a little bit about our overdose fatality review. I'll give you a very brief overview. But basically, what fatality reviews are is they're a multidisciplinary process. And we use this process to examine the circumstances of death. And we do this in order to identify ways to prevent future similar deaths. So it's all about prevention. We identify those cases. That's the first thing that we do. And then we review those cases. Due to the high number of cases of overdose in the state, we do review those cases in themes. And we select those themes based on analysis and review of the overdose deaths in our state. Megan is a huge part in helping us choose those themes of cases. So for example, some of the themes that we have reviewed previously, we have reviewed our fentanyl overdose cases. We've reviewed cases where there was a veteran involved or where there was a person who was recently released from an institution. Currently, we are reviewing cases from specific geographical locations. So basically what we do is we come together as a group and we're looking at the entire lifespan of that individual. So we're reviewing all the records that we can get our hands on, including the death scene investigation. And then we have subject matter experts and data providers in our committees who also provide secondary sources of information. These include people such as the Poison Control Center or our Controlled Substance Database. We have a wonderful group of people that are willing to provide this information. And basically, we're looking at that lifespan in order to identify system gaps and opportunities for prevention that were missed. It's not a finger pointing exercise. It's based on all of the information that we can gather in order to prevent future deaths. That's our absolute main goal. Next slide, please, Phil. So as I mentioned, we have a wonderful group of people who come together. These are the members of our overdose fatality review. They're all subject matter experts. And then we have a smaller group that is our data providers. So for example, we have people who come to the group who are specifically providing medical information, or as I mentioned, poison control information or treatment information. And this allows us, again, to look at the entire lifespan of the individual. When we review specific themes, oftentimes we will invite additional subject matter experts. So for example, when we reviewed our veteran cases, we had members of the Veterans Administration who were there to help with context. And we'll invite those different community partners as well. Next slide, please, Phil. So this slide is basically just an example of what we're looking at. So when we're looking at the lifespan, we're looking at all those major touch points that that person had with systems so that we can identify those prevention efforts. And the really wonderful thing about overdose fatality review is we're able to collect this information and we're able to see it start to finish. And in doing so, we're able to identify those opportunities that were missed. So we include all of this information along with the information from our other data sources because we want a more holistic view of their life, which creates opportunities for recommendations. And that's what we're looking for. Next slide, please, Phil. So after every case is reviewed, we develop recommendations based on that particular case. And then we analyze those and group them into categories. So as you can see here on this slide, these are some of the recommendations that we've developed. And then the next step is to further refine those recommendations. And then we take those recommendations to a champion or to a person who can really champion that recommendation and make it actionable. So that's what we're looking for, are those recommendations that can really make a difference. And the committee is really good at identifying those recommendations. And like I said, we're very lucky to have a wonderful group of people who are very passionate about prevention and about really making a difference based on these cases that we're reviewing. Thank you, Bill.
No, that's great, Casey. And I'm part of this. I think everybody on this call is part of, at least the presenters are part of this overdose fatality review committee. And it's really important because these recommendations that really are consistent. Casey, correct me if I'm wrong, a lot of these recommendations that come out of the overdose fatality review committee are very consistent in a lot of regards with some of the other review committees that you manage. And so one of the things, especially with this, the OFRC, we want to make sure, and I want to advocate for, as I said earlier, for a lot of the great work that Casey and Megan have been doing for a long time. Casey, in regards to these efforts, to the review committee, especially the overdose review committee, and bring those to the attention of the decision makers in the state, they can obviously, start charting a course forward on how can we address these and not consistently have the same recommendation that can be addressed. Some of the recommendations, obviously, they're larger societal issues, but some of the recommendations we can actually act on, at least, advocate for funding, be it other things, awareness. So I appreciate that work, Casey, and everybody on the call. So Molly, we kept it at 45 minutes as promised. Keeping me quiet is the hardest part. But I just want to thank everybody on the call for the opportunity to present what we presented today. I'm very proud to be associated with each of these individuals. I've worked with many of these for a long time. Some of them recently as part of this effort. We recently created the Utah Fentanyl Task Force email at a recommendation from one of the working group coordinators. We just got that up and running. Obviously, we love feedback. We love questions. If there's any questions now, obviously we can answer those. I don't see any unless I'm missing something. I don't see any in the chat. So hopefully there was some questions. If not, please feel free to email us at that address. And Molly, I'll turn it over to you if there's any questions from anybody that's on the call.
Yeah, absolutely. Holy smokes, I'm so impressed that you guys fit that in 45 minutes. We have single speakers who can't do that. No, it's great. So if there are any questions from folks online, please feel free to either enter them in the chat or in the Q&A box. Actually, I see we have a hand raised. So Will, I'm going to promote you and allow you to talk. Will, go ahead.
Yeah, I appreciate that. I was just curious if you could expand on the role of the National Guard on the task force.
That's a perfect question. Matter of fact, I think we have Chad. Are you able to unmute yourself? Chad Wilkins, the program manager for the Utah National Guard. Molly, maybe you can see him. Or Chad, so that's a great. If Chad can't, Chad, if you just go in the chat. But so it's a great program. So the Utah National Guard, we work very closely with them in two respects. On the public health or public safety side, the counter drug intelligence analysts that are assigned to the various larger task forces around the state and support their efforts and, obviously intelligence analysis and connecting the dots. The Utah National Guard has a program called the Drug Demand Reduction and Outreach Program, the DDRO program. And we are very lucky to have the program manager for the DDRO program in the state assigned with us here at the SIAC. It's Sergeant Chad Wilkins. I believe he's on the call. He called me earlier and asked for the link. They're a great partner because they work very closely throughout the state. I think they're currently working with 40-something community-based organizations throughout the state. They do things like drug take-back. They coordinate things like that with DEA. They're a great resource. Matter of fact, the DDRO program here in the state of Utah was named the National DDRO program a couple of years ago by the National Guard program out of the Pentagon. That's really due to Specialist Chad. At the time, Specialist Chad Wilkins. He's been since promoted to sergeant. There's actually, I believe, 3 DDRO program specialists now around the state, which Sergeant Wilkins supervises. And they do a lot of great work. There's a website you can go on the National Guard DDRO program, or if you want, you can email us at that email address that's on the screen. Hopefully it's on the screen. And I can certainly put you or anybody in touch with an individual in your area that can provide some great training. Matter of fact, recently I got called by the health department in Tooele County, and they go, one of the greatest trainings we ever had was a couple of years ago by, so I couldn't remember the name. I said, was it Chad Wilkins? Yes, it was Chad Wilkins. That was the best training we've ever had. I said, well, that's great, but they do a phenomenal job. So hopefully that answered your question, Will.
Excellent. Any other questions? You're welcome to either raise your hand, enter it in the chat, or enter it in the Q&A box. And yeah, I don't see Chad online.
Yeah, he was in training. He said he was going to try to jump on. He's actually in some National Guard training right now, but I'll make sure.
Nice.
Will, if you want to get in touch with him, I can certainly facilitate that.
Perfect. Any other questions for any of our panelists? All right. If not, please join me in thanking the panelists for joining us today. This was super helpful and enlightening, and I'm excited to see how it moves forward. A reminder to all of you online that the legislative session begins next Tuesday. I'm sure we'll be seeing some legislation tied to these issues and other municipal issues, so please stay in touch with us there. And Local Officials Day. So our day on the Hill will be next Wednesday. The last day to register for that will be tomorrow. So if you have any questions or concerns about getting signed up for that, please let me know. But with that, please join me in thanking our panelists. All right. Excellent, everyone. Thank you so much and have a great day. Bye.
Thanks, Molly. Thank you.
All right.
Bye-bye. Thanks, everybody.
Thank you.